before I met the first time I met Dr. Mahmoud was actually when I was a student in my undergraduate bioethics course. And when I say this, and Dr. Baroud is now a resident, and I still remember that, that already tells you the impact that he left. He left when he graduated from the course, and I still remember him very well, his sense of humor, and his superb questions and presentation. And then he did his MD at the American University of Beirut, followed by residency in plastic and reconstructive surgery. We all know that unfortunately, Beirut was hit by what is now referred to as the 4 August Beirut blast. And after the Beirut blast, we started seeing these posters on social media. The amazing thing is that it is from a physician who is willing to offer services with as much difficulty and expenses that this might incur, and offer free plastic surgery care, and even reconstructing previous plastic surgeries that were done rather in a haste. And Dr. Baroud will say more about this. And his story was all over the news, as you can see. This is one article from Bazaar, which states how one plastic surgeon is providing a different form of relief to the victims of Beirut blast, and in which Dr. Baroud stated, I started offering my services on the third day after the explosion, as on the first day I was in the emergency room helping other doctors. The second day, everybody was in shock. It was on the third day that I realized I could offer the service. From that day onwards until about August 8th, I had about 20 to 25 people per day. Now the patients are starting to decrease in number, and in another article I read, they reached in the hundreds. He says, and I love this quote, I consider the flesh wounds victims sustained to their bodies to be the minority of the damage done to the Lebanese people, but the degree of relief they are getting from the fine-tuning of their wounds so they don't have to look in the mirror every day and be reminded of that terrible day is important. This is a message, our message today, or the message that Dr. Baroud has been propagating, if you wish, is that of humane medicine, is one of medicine which is far away from being a trade, rather a humane moral endeavor. In Vogue, we see another article talking about him, not just deep skin deep. This is the doctor fixing Beirut scars for free. And he said, I don't know if he's willing to talk about this. I've experienced a scar on my face within the past year. I know the feeling that the person passes through when you have an opening in your face, and it's really not pleasant, neither for the mental effects. This is a short video. I don't know, you can watch it. I'm not going to take time from Dr. Zarouk's presentation, but you can find it online, on Instagram, on BBC. This is a patient talking about her experience with Dr. Baroud and how it really helped her move on with her life.
Would you share the presentation with us, doctor, so we can follow the links?
Yes, أكيد.
Yes, sure. Thank you.
Let me see if I can show it to you. It's a short thing. Let me see. عم تشوفوا السكرين هلا؟
No, it's blacked out. It's fine. We can move on with the presentation. Just if you can share it with us after.
هلا عم تشوفوا؟
No, still covered.
Okay, so I'll send you the presentation. Another thing I would like to highlight is that Dr. Baroud is the student of Dr. Ghassan Abu Sitti, who you already know. And the reason why I have this is several reasons. One of them is Ghassan is a very dear friend of mine, and I have always been touched by his humanism. Joe, حفظ الألقاب, is a very dear ex-student and colleague of mine who also touched me with his humanism. And I think role modeling played an important part. And I think, and Joe will attest to this more or say more about this and maybe even send a message to his mentor. I look forward, and I think it's already started, to having Dr. Baroud being a role model to many other physicians. We talked about this last time. This is Dr. Ghassan Abu Sitta treating also patients for free. And just for all of you to know that we have launched at AUB the Ghassan Abu Sitta Bioethics and Medical Humanism Library, And we look forward to having, at one point in time, Dr. Joe live with us there, talking about his experience as well. I will close with this. We are shining the light on Dr. Joe Beirut for providing plastic surgery services free of charge to patients who sustained facial injuries during the Beirut explosion. Thanks a lot, Joe. Dr. Beirut, the floor is yours.
Thank you, Dr. Arabi, for this nice introduction. Can I start with my presentation?
Yes, we need you to share it, of course.
Presentation on the screen.
Not yet. Diana?
No, not yet. I think you need to reshare.
Okay, I will share.
Okay.
Perfect.
Now, yeah.
Are you seeing me also as I'm speaking, or I can?
Yes, yes.
Okay. So I would like to share this experience with you guys, and I would like really to discuss some of the things that I have been struggling with since I first started doing this initiative, helping the Beirut victims. And of course, during the first period of helping out, it was a strong impulse for me to go and put myself all into this without asking any questions, like helping anybody on any situation that I can help. And then as the days pass by and the months pass by, I've been doing this for the last 80 days, and really it started to become a strong effort on me, knowing that I am doing it by myself. So here I want to show you how I first started. I will show you all the type of injury that I saw and overview of what the treatments that I have done, so that I can start to ask the ethical questions about the specific cases. And also I will ask about when to say no and when to stop helping, and what is the ethical dilemma that you need to help me with. So August, the time in Beirut has stopped, so has it stopped in my clinic. And really, I've been seeing the same story over and over again. Up until 10 minutes from now, I was seeing also injured patients coming. There are thousands of people in, and they're like a never-ending flow of patients coming through. So here was the first day of the explosion. I was involved in going and helping as many victims as I can in Khoury Hospital. Also, some of the patients that were in my clinic also got. This patient, for example, was 30 minutes there before the explosion, and then I knew that her brother passed away. Her family all is heavily injured. She is a big mess. And so after the second day from the explosion, and I went to see her, I just thought that I only reach tens of people and thousands are injured, and I could not just look at it and sit back and chillax at home. So what I did is I put this Instagram feed because I knew that how many people are injured, and I wanted to help as many as possible. So I put this Instagram, and it really went viral. Really went viral. Only 6 hours after I put this, my WhatsApp, and this is my personal number I put here. So my WhatsApp started to flood with people asking me about their scars, what they need to do. Now, of course, this was the third day after the explosion, so everybody had already had their suture. Most of the people who had already been sutured, in the nature of the disaster, it was emergency suturing just to stop the bleeding, so no cosmetic attention was made. So people started to send me pictures of their wounds, their initial wounds. Now here, if I want to discuss just briefly to see because I said here that I am treating the major facial injuries, caused by burns or other mechanisms of injury. So people started to send me their injuries, and here you can see the big types of glass, because most of the injuries I've seen were glass cuts. Here you can see the more extensive, smaller glass cuts, like explosion of shrapnels of glass. Uh, and technically, this was more difficult to treat than the other clean cuts. Here you can see clean cuts, these glass cutting right through cartilage of kids, of women, men, all age groups. Some cuts were not so clean cut, and they had more extensive tissues that were children, kids, babies. No passes were given that day. And then I started to just do scar revisions for every. And when we were med students, we learned that no scar is allowed to be closed after it has been open for more than 2 or 3 days. But in the face, the story is different, because the face has such a good blood supply, and you can do more stuff in the face than in the rest of the body. So I was allowing myself to revise scars. This is, for example, after 4 or 5 days, I would just cut this back open, close it, and make better approximation of the wound edges, so as to give a better outcome. Because really, I was not letting anybody go home and wait 1 year for this scar to improve and then revise it as written by the book. So I was doing stuff that I allowed myself not to have anybody home with a defeat on their face. You can see staples on the face. You can see more staples on the face. I'm going to go roughly very quickly, because this is not the topic of the presentation, but the topic is about the ethical dilemmas that I have faced. So here you can see eyebrows. All of these I have been doing between 10 and 12 days, removing foreign bodies. This was a very strong trauma to the cheek that caused the parotid gland to rupture, and the parotid gland started secreting fluids under the skin, which caused this sialocele, which is a salivary abscess that's happening in food after eating a meal. So I did the serial aspirations for her, didn't work. Another treatment didn't work. I had to shut down the parotid with Botox, so it worked at the end. Lip adhesions, open wounds, nasal reductions, massive amounts of glass in the face. So some contractures of the eyelids, also the lower. So maybe so far I have, the last time I counted, there were 200 patients that I have seen, more that I have seen, and basically the first few days, up to 10 days, I was revising scars. Then after, I was giving people the scar care creams that they needed. After that, there came a phase of infected wounds that I had to also treat. And then came these types of contractures that were tucking. When the wounds started to heal and they're poorly sutured, we started to see this. The treatment of these injuries, I was getting people with all types of facial injury. So some had major facial injury, all people, because I knew what to write in my Instagram post, because there are 6,000 injured and I cannot really one person treat 6,000 people. So I wrote, and I narrowed down the population. So I wrote to all patients with major injuries to the face, major injuries to the face. This way I can really make sure that I will be helping the people that have significant injuries. But some people were coming with small cuts, small injuries, like 1 centimeter, 2 centimeter cuts on the face. But it is, however, it is poorly sutured. I can help them with that. But really, I don't have the luxury of time when I'm being flooded with other patients. So this was one of my first ethical dilemma. So I clearly stated in my Instagram that major injuries, but people with minor injuries were also coming. And what do I have to do? Accept them or deny them? But really, at this step, during just a small cut here, but definitely the wound was poorly sutured, and I could just refresh the edges, tuck them back in to give. And this is what I did. Really, at this time, I was really frustrated because of all the situation we've been living in Lebanon. So I didn't think twice about it, and I was giving care to anybody with minor cuts, major cuts. I was coming for minor cuts on Sundays so as to not be late for the wounds, because day by day we are playing against the clock. Second question also that I faced. People with major injuries to the I can help them, but now people started to come with the injuries to other parts of the body, their hand, their neck, their arms. Would you personally accept or would you personally deny? So I am putting this. You can see this is not question number 2. And if somebody has please an opinion about it in the discussion, please let me know. So the first question already passed. If other than major injuries, what would you do personally and why? If you have posted that you will be helping the major injuries of the face, and then somebody comes and they say, oh look, I have this injury in my hand, what you gonna do? Are you gonna say no, I can't? Are you gonna tell this 80-year-old woman who presents at 9 o'clock in the evening and she has a necrotic finger smelling and pus going out of it, oh, you have to go to a hospital, I don't do other than face, but you are also trained in hand surgery and you clearly know what to do for that. So what would you do? What would you do for a young girl who has this open toe and no other medical care to other than yourself? What would you do? Would you leave it? Would you fix it? Also, people also started to bring the house workers who they work at home, and also with these kind of injuries. And really, what would you say? Would you say, hey, listen, I am only working with the face, please take her to the hospital? And you know that it would take few milliliters of local anesthesia to fix it, but at the same time you are overwhelmed with other patients, and you know that this is not going to be the only job, because this is not this needs follow-up. This has potential for complications, especially in the hand, because the hand has a very poor blood supply. So are you going to defer this treatment or are you going to take it?
Of course. Can you hear me, doctor? I think I would defer them if I was the surgeon, although I'm not.
Yeah.
As an outsider, somehow, I think in war, between quotations, and you have to treat certain patients instead of others.
Yeah.
You have to take that decision. And you can help everyone, but at the same time you cannot, because of time constraints, because of resources, because of many other factors. So
Yeah.
it's I think it would be somehow unethical if you manage to give the resources to those who don't need it as much.
Yeah.
So I think it's hard to say no, but you have to say it if you have other people with more severe injuries that need treatment. So that's why, and I don't know if you saw it on the chat, it depends on the situation. Yani. Let's say that week nobody presented with serious illnesses or scars.
I mean,
You can go with
you
the
can,
microdose.
you do have the luxury of time, but you will have to stay up till 12 midnight to continue all the work that you have to do. You will be able to do it at the end, but you are at the end taking a piece out of yourself, out of your comfort, out of your resting time.
Yes, that would be noble, but I think it has a limit. يعني you have to be well in order to treat people. Don't take it to the extreme. يعني مثلا هلا انا يعني ما جاي على بالي مثلا خلص حلوا عني. Although you can say that, but give yourself at least the minimum and then look for others.
When I first started with the mission, and these were open wounds, I was very emotional. This patient came with her, the worker came with the house, the people she works with, and they told me the girl saved our kid's life. She jumped at her and hold her and wrapped her body, and she got all shrapnel with glass. She lost her eye. She has scars all over her body, and this one is still open. You know?
So, Dr. Ben, may I chime in here?
Yes, please.
So just to comment on the last, on this one, the one you have now, and to also agree and comment with what Muhammad said. As a physician, of course, we always believe that we have a moral obligation to help others, but it's important to somehow strike a balance between your own burnout, your own psychological well-being, your own ability to help, and the urgency of the wound. عم شوفك عم تضحك for some reason.
I'm burned out من هيك.
I can tell. So one possibility is to schedule a specific day for non-facial wounds. Another possibility would be to ask other colleagues who will be willing to offer the service with you. So you would share, someone will do the hands, you will do something else. But most importantly, I think when it comes to an open wound, it seems to be something akin to what in the States we call the EMTALA law, or what in Lebanon we preach that we need to do whenever you have someone coming to the ED. If it's an urgent case, we stabilize and then we transfer, because we don't have infection and they are at your door, particularly with an overload at the hospitals. But you definitely need to think of some triaging mechanism. You have your moral exhaustion to keep in mind. The idea that what's major to you or minor to you might seem major to some of the patients. So I don't think you can do all this alone. You definitely need a team with you to make this holistic, a counselor and someone else who do the surgeries for you.
Right.
The last point, was there a last point? Yes, migrant workers. My main fear is if for any reason we deny care to migrant workers, someone out of the blue, for good or bad reasons, and I think it's the latter, will say you are discriminating against them. أنا تستقبل الكل بس this person because she's a Filipino or she's from
This
Ethiopia.
I was making sure doesn't happen.
Yeah, there you go. And sorry.
I think the doctor shouldn't say yes because the person is a Filipino at the expense of someone. يعني just at the expense of someone who actually needs the care more, just so that people don't speak or don't attack.
That's why it's important to triage and to have someone work with you, definitely.
أكيد إنه if everybody did what they can do, يعني the best they can do, I don't think that we would have as much consequences and catastrophic events after. Not everybody does that. The doctor chose, Dr. Barud chose to do this, and he has to be selective.
Okay, now I want to show you more and more ethical dilemmas. Now, this one is a simple one. Let me continue.
Doctor, we had in the chat, we had a question from Matthew.
Yes.
So he was asking, were the patients coming directly to the clinic without notice, or through a phone call. يعني they were calling before asking.
I was giving my number to all the patients. Like my number was on Instagram, and they would contact me. I would ask them to send me a picture of their wounds. Then I would decide if they can come or not, and I would send them my clinic and tell them to pass by.
So, Dr. Baroud, if I may suggest and take time to think about it, we have a lot of students medical students who would like to volunteer in a number of initiatives. We have this superb group called Khilkhal.
Yes.
And I'm sure if you want someone, for example, to take the number from you, in other words, تحط رقمهم لكم شخص, they would prepare an Excel sheet with the types of injuries, with the seriousness of injuries, help you in triaging them. So at least you will not be responding to phone calls. Someone else will prepare something else for you. So I'm sure we can provide you with a superb team if you want. And we can talk about this over the phone.
If anybody would like to help me out from the students, I would be very appreciative to like sort of triage the patients and organize the flow, because my timing, because now I am doing it as from 5 to 6 daily. Like I have decreased the number of hours I'm working with the injured to 1 hour per day, but still I am doing some surgery, still doing some revision, doing some follow-up. Many people have complications, so yeah. And the number of people that are injured are huge, so we can continue doing that.
Okay, so what I will do is we will talk, you and I, over the phone, and I will ensure we have a call for volunteers, see how we can help out.
Nice. Let me ask you more questions. So when I started to do my work with social, helping out the people, I continued to post on social media what I was doing. I was posting as stories. I am usually active on social media. You can follow me, Dr. Joe Baroud. I am very active. I usually put the stuff that I do during my days on social media. And now for the victims, doing the same thing, and I was always asking myself, like, is it something good to do that? Is it something good to put on Instagram what I'm doing as helping? Should you do should the good deeds be done under the light, or should they be done in silence? Is it ethical to use the victim's social media content? Now, putting aside whether this patient population is a vulnerable population, would you consider it a vulnerable population group? Like, I was asked patients if I can use their pictures before and after. Surely, after I would treat them, and they will definitely feel that I am not going to be biased, that if they said no. But most of the people were actually eager to allow me to share, because they wanted the other people to see, and to reach out for me. And also other people would link with the types of injury and see what I'm doing with this injury and that injury. And then other people would call telling me, oh, we have the same kind of injury, so can we come and you will do us this treatment, etc., etc. So yeah, that was my ethical question at this time. Are these people a vulnerable population group? Am I taking advantage of it? And at the same time, if I would not use a social media, like, the counter argument would be, how will I increase my reach to be able to help more? And also, how would I have gotten so much donations of instruments, of raw material, of disposable items, of sutures, of gauzes, of everything? Like, I could sustain the thing from my own pocket for a while, but then the amount of people was huge. So I was getting a lot of donations, and really the Instagram posting and stories and being active on Instagram helped me a lot. But this is still, until now, it is still a dilemma in my mind, whether really it is ethical Is it ethical to put that, oh, look, I am helping out people, see me? Is it going to be understood in the wrong way? But now people also know what that, like, people can read the other person's deeds, and most people are not understanding it in the wrong direction.
Doctor, I
Yes.
think if I might add my opinion, when it comes to this issue, the 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 main thing is what you are thinking, or what the person doing the good deed is thinking. And if he's doing it so that people praise him, it's different from if he's doing it because people need it and he's doing good for the community.
Yes, of course.
That's nobody
It's
can
very
answer
mature, actually.
or can decide. The point is, anyone, you need the social media to get more people to benefit from what you're affording them.
Right.
But that ethical issue, I think nobody can answer that. It goes to the intent.
Right. Right. Especially after I started to get a lot of media coverage. BBC also hosted me live on the morning show. Endless magazines, local and international magazines. So I started to feel from one side that I cannot say no to the magazines and the media because it would, in a way or another, increase the reach and people will be knowing. And in another argument, I did not want this to seem as if I am making any like advertisement for what I'm doing, because really this was not my intent.
I
I may
Doctor?
add,
Sorry, go for it, Samira.
okay. Sorry, I was saying, if I may add, I think, the step showing the progress of your patients, it shows transparency كمان to the population that you're targeting. And it shows you're really doing the job that you're saying you're doing, and you're not just مش كم عملية وخلص خلصت. لا, in fact there are huge numbers and you are doing your best to help these people cope with what has happened and ameliorate the condition تبعول هدول الناس. So
Right.
on one side it shows the good work that you're doing, okay, but you're not doing it for yourself to like praise yourself. You're doing it بنية إنه it might help other people see what you're doing, so that if they need the help they can reach out, or if they know someone who needs the help they can share with them. مثل ما محمد قال محمد علي قال it's based on what you think you're doing, more than what people will think. If someone follows you and sees your stories, they will understand that you're sharing them for that purpose. If someone comes in from an outsider point of view and doesn't understand that, it's not on you. I don't really think you're supposed to consider the outsider point of view. I think really, for real, بالنهاية if you're gonna be thinking about what every outsider is gonna think, ما حدا بيعمل شيء.
Yes.
فإنه yeah, it's a win-win situation, kind of, not a win-lose.
You know, when you're looking at it from inside and you're very self-critical, you just worry a little bit. But thank you for the things that I need to hear. Really, Samira, thank you.
So to add to Muhammad and Samira, if I may, Dr. Baroud, I can see that your ethical concerns are spicing up as we move on.
Yes.
Absolutely. The issue of consent here is tricky because you tend to wonder how authentic is it, since these are vulnerable populations. These are people who want to get your help for free. Will they dare to say, no, we don't want? We are living in a different era, unfortunately, or fortunately, I do not know. That's another story. But with the presence of social media, and it's being very essential for you to reach out to other patients. This is, I think, that tips the scale. So I would suggest you, and I think you already did that, ask them before you start the procedure. Once you have medical students with you, hopefully with the triage, they can make this for you instead of you, so that will remove some strain from you. They can ask them on your behalf. Should you do it silently? Of course not. If you do it silently, no one would know and you will not be offering help. So we have to decide which principle trumps the other one. I think the way Dr. Abu Sitta touched you is from what you know about him, from what you've seen in the media, right?
Right, that's true.
Exactly. And as bizarre as this might sound coming from me, but we live in a world where good deeds are very, very scarce. So it's uplifting. أنا أول ما قريت the message, I was so happy that you're doing this. So we need good examples and we need good voices.
Thank you.
So
Okay.
that's
Now,
it.
let me continue. I will go very quickly. How much do we have? We have 30 more minutes.
So ideally it was 30 minutes for you and Q's and A's, but since we are talking, students are talking as we move on, I think you can take more time if you wish.
Yeah. So this girl talks to me fourth day of the explosion. She's telling me about her story. We're talking after midnight. You can see after midnight was the only time that I can really answer my messages. They took away my dreams. They took away everything. I hate them. The second day she calls me. This is her friend, best friend, Romy. I say hello. Aya. I say hello, Aya. She says this is. She lost her best friend. She lost her personal pastry shop. She lost her home. She came to me period. I couldn't have more mixed emotion of this mixed emotion of I can say it was a very uplifting at the same time so distracting to the soul. Really, this girl I will never forget in my life. And she was the girl that we filmed the BBC interview with her. So you can see the BBC interview when you see the press back. You can see the link, or you can also see the BBC interview on my WhatsApp, on my Instagram. So this is the 40-day progress. So this scenario, the patient comes, his mom calls me 10 days after the injury. She tells me, look, this is the scenario. This is day 1 after the injury, and this is now day 10. And I know as a plastic surgeon that this wound is heavily contaminated and it is infected, and probably not treating it thoroughly and emergently would cause more infection, maybe start to have osteomyelitis of the nasal bone. So what should I do? Like his mom contacts me, asks me to pass by to their house because he has a fracture and so should I agree to give extra time and go to their house and see the patient and take with me my kit, etc., etc. So would saying yes to this patient be a way to say no to other patients? And give scenario of this patient, what would you respond? Your answer to this?
Maybe a utilitarian approach would be appropriate. إنه at the time that you need to go to that patient, what's happening? Do you have other similar patients? Do you have more patients? Or the patients that you're seeing are old and probably very close to dying compared to a young child who might lose his eyes? Or
No, you are actually treating 5 to 10 patients that have medium risk, that are only purely cosmetic, and you will improve their cosmetic outcome versus one patient that will take the time of the other 5, but he has a more critical scenario.
That's a tough one. I think I'd go for the baby or for the child. ما بعرف. That's tough.
Yeah.
So دكتور بارود كمان very very quickly أول شيء بالنسبة للواتساب post that you're getting, that's why I think you need a team with you and someone to counsel the patients as well. And we have people we partner with. I think it will make your treatment, what you're offering, holistic. Once you are connected to people, you can simply have your residents come in. This is another issue, or the student to forward to the patients. Now, whether you would go or not, you would be definitely setting a precedent. You can't say to anyone no anymore. It's a personal choice.
Right.
If we have residents with you, as I suggested earlier on as well, you can send the resident. He can do what's necessary, get back to you if need be. So you can't be abused. You will end up hating your profession.
Exactly.
You will end up with boredom.
For me, really, I don't know how to say no to anything, but in this situation, I felt that I was starting to become abused. So I had to tell the woman, listen, I need to be in my clinic in order to do this. I might need some instruments and equipment that I cannot bring with me to the house. They are machinery. And so you have to bring him to my clinic. That's it.
Oh, that's outside thinking outside the box. That's great. أكيد someone can get that patient to the hospital. شو ما فكرت
I was
فيها.
gonna ask إنه if the patient إنه ما بيقدر يجي بالمرة, or you can suggest maybe someone إنه if you know a contact who can bring him in, أو إنه if there are people who are volunteering to bring people in if they don't have the facilities أو شيء.
هلا what happened انه هو the patient would feel uncomfortable when he is moving because he has fractures in his legs, both legs. So he was bound. When I told the woman that he will need really medical attention, but I cannot but see him in my clinic, she contacted another doctor, who was the main doctor who did this for him, and he went to his house and he fixed it by himself, opened the wound, cleaned it out, and did the job. So the job was done by another doctor who probably was not having so much pressure on him. I had very clear conscience saying no, and obviously when really there is a will, there is a way. So they found somebody else to fix it. So I will continue with this. This case, I don't know if you guys heard of her, Yara, the 3-year-old girl who got really big propaganda on media, on TV. And this girl, she presented. Her uncle calls me on a Sunday, and he sends me this picture. He's like, "What should we do to this girl?" I told him, "This girl has an open wound, and it cannot wait. It's day 5. It cannot wait till tomorrow." So I went to my clinic on Sunday, opened up. I had my brother help me to to hold her down with the towels, and under local anesthesia, I facial scars, improved the scars, closed them back, they were all open, and I heard again from this patient. I never heard again from them. And on the media, everybody was talking about her. NGOs were thanking other people for giving donations. Hey, thank you for your donations and for allowing us to help Yara. But really, Yara had gotten help for free with no donations. I did it for her for free. Also, other plastic surgeons started to take pictures with Yara and post them on social media as if they like to take the lights for, because she was really a very innocent looking girl with this face. Really, everybody felt so heartbroken for Yara, and she went on TV. So her father was interested in apparently in money, and when he went up on TV, this plastic surgeon. Thank you, Dr. X, for helping Yara and for being on board. And you are going to continue treating Yara. And we could have never done it without you, Dr. X. And the father asked them for follow-up and to come back so I can see her, but the father never brings her back to follow up, and all the credit goes to Dr. X. Now, is this a reason to stop being enthusiastic about helping out other patients? When you're helping out, are you helping out for the credit, or are you helping out just for the good feeling you get of knowing that you were able to make a difference in the life of this person? And yeah, the second question, which is the more important question, because I know that Dr. X might have some complications. And what if Yara comes back because complications from Dr. X? Would you treat her? Would you correct the doctor's mistakes if it was up to you, knowing the story?
May I intervene?
Yes.
I think that's the beauty of يعني telling people versus not telling them. إنه it's a two-in-one situation. يعني هيدا اللي بيقولوا العمل الحسن المعلن, and it's secret at the same time. So I think you should be very happy إنه you're getting both of يعني you're getting the best of both worlds.
Yes.
Yeah. You know that you did this and she improved, and nobody knew about it except you.
Yes.
Which is very good.
Yes.
هلا بصير في مشكلة moral obligation أو moral dilemmas على the other doctor, Dr. X, if he accepted the credit.
Yes.
That would be very bad, يعني very unethical. And for your part, I think it's very good. يعني I think إنه you should feel great about this. And concerning the next question, إنه if complications occur, هون حس إنه a consent أو a document انكتبت أو شيء إنه would be the way out. I think ما بعرف if you get my point. إنه if you want to treat her because of what another doctor did to your surgery, ما بعرف if there should be a paper stating what you do. ما بعرف if you got my point.
Yes.
So that if you present to court, you can use that as a proof. Yeah, that's a great.
I was really heck, I had a lot of positive emotions when this thing happened, and everybody was calling me, Joe, how do you accept that other people are taking credit for your work? And I was really with a smile on my face, but it was a happy feeling because I just saw the reality behind media and how media tries to publicize some emotional content and use it to the benefit of just publicizing people. And I was really happy not to be part of this. And I was really happy that I did play my role behind the scenes, as you said. It got me great satisfaction to see that other people are trying to get credit of what other people did, but it did not at all give me any negative motivation towards continuing the treatment of other people.
Yeah, that's عن جد. I really like this situation or this case specifically. يعني it's also يعني as you can see it as an opportunity to see if you're going on the right way or not. And had you felt very يعني ما بعرف مقهور مزعوج إنه you would have known that something was wrong. إنه the way you're approaching things. I think this is a great يعني experience that you've been through, specifically this case. Yep.
I agree.
Also, I think the fact another doctor would want to take credit for your work means your work is spectacular. and it's flawless, which means that it makes you feel proud on some level, and okay, people are acknowledging I did a great job without even knowing the job, which gives like
Yeah.
a personal satisfaction. I'm proud of what I have done, even though the public doesn't know. It gives me even more satisfaction because now I know the truth, even though people don't know the truth, but I know I did something good for that girl, and like when she grows up, if she's gonna be very grateful, and she's gonna look at me as the bigger person who didn't go out to like reach out and correct people and no, I did this, because بالنهاية what you care about is treating people, not getting the
Exactly.
like the not capitalizing on the treatment and not getting the publicity in a wrong and under the wrong spotlight. And the people who know you did the procedure, they know.
Yeah.
That that's for you would be enough. And okay, خلاص, people who know that I did this already know. And the people who maybe misled, that's media, as you said, يعني صراحة.
Exactly.
But it gives, as you said, some sort of satisfaction on a personal level, and you did something good and nobody knows about it. It's like a secret accomplishment.
My little secret. Keep it our secret.
Dr. Baroud, let me, I agree with what has been said, but let me play the devil's advocate and highlight something from the other side, يعني another argument. أكيد when we do something good فضلنا على حالنا بالآخر, we're doing it لله, we don't care about reputation. However, if this to happen to you, say 10 times a month, this is going to really discourage you morally. But
Yeah.
I know that you will thrive, but you are human, and we cannot ignore that you have a psyche. However, what worries me even more is one time Edmund Burke said the only reason for evil to flourish is for good people to do nothing. So
Yeah.
are we, by omission, encouraging people like the other doctor to claim their trophy on someone else's land? Is our silence leading to more wrongdoings? That's an important question.
Yeah.
I don't expect you to go to the media and say it was me who did it, because I
Yeah.
know you very well. I would hope that some of your colleagues or friends would, one way or another, post a big thank you to Dr. Joe Baroud for helping Yara, so someone else will voice your voice.
Yes.
We can't let evil propagate by being silent and by omission. Thank you.
Right.
Yes,
Right.
doctor, I agree, and I think there are a lot of people who would do that. Yani if they notice the pattern, and I think a lot of people would speak out, because I think we're more aware as a generation هلا إنه who to give proper praise to. يعني if praise is being given to the wrong person and people know that, I don't think they'd be as silent. And because media إنه يعني simple things, يعني just over WhatsApp, if you send a text to someone saying إنه oh no, this was done by this doctor actually, and you send them like a link, and they send it over and they share it, it spreads very fast, much faster than media was like very long time ago, where like newspapers or television were the start of the media. يعني. But I think and because of technology we can like kind of reduce that. Okay, maybe that doctor might feel tempted, or it might be tempting for doctors. I don't think an immorally شو بيسموه, like a morally aware doctor would want to take praise for someone else's work. But
Right.
and there's, on the other end, there's the supporters and the people who know the truth, who will fight for it, or who will like speak, I think.
Now, if it had happened more than once, I would definitely not have kept silent, but it happened once, luckily. But yes, very, very, very good point indeed. We should not let this be a pattern. Now, this doctor was charging people. He's a doctor that has a clinic right clinic 2 streets. He was charging people in cash money big amounts to suture their wound, to revise them. Hey, this doctor that is doing any volunteer work, But people are coming to him. He is telling them, yeah, I would revise it, but you have to pay me $300 cash before I eat. Is it okay to do such a thing, such behavior, to charge patient in this circumstance? I say no. I say maybe he has the right to do it. Definitely, he doesn't have a big heart. On the other hand, he has all the right. It is his business. It is. He can charge if he didn't even state that he wants to do any volunteer work. But the other
Doctor, I had a question. Now the opportunity came. Yani, had you not received any donations, what would you have done? Yani, and I think you need to take money if you don't have donations. Specifically, إنه أنت بلشت, I think, from your own pocket.
You know,
صح؟
you know how much it would cost to do this for one patient?
I don't know really.
$10.
Wow.
Yeah.
Yeah. Wow.
So I was ready to do that for 1,000 patients, but then I started to get donations, so I had no problem. But doing it for
Dr. Beirut, are you happy not charging and having asked for donations and helping people for free?
no, ask for donations. I didn't ask for any donations.
Receiving
People were
donations.
sending donations, were flooding my clinic. Some days I couldn't walk in my clinic because of donation boxes. Donations
So
were
would you be happier
coming.
had you charged?
No, of course not.
Again, you answered yourself.
Now,
You just answered yourself.
now
Have you been in a
this
situation
doctor,
like
sorry, I have to say it, this doctor didn't frustrate me because he was not acting as if he was something else. He didn't charge. He asked for charges, but he didn't say that he was doing any volunteer work. But the worst doctors that I despise are very, like, there are well-known doctors that publicize that they are helping for free, and they played on the words, and they said free consultation at Dr. Kaza, and yeah, the consultation is for free. Like, I would tell you that you need to suture this wound, it's for free. But when you want to suture it, it's not for free. You know? So these doctors,
two main problems we're having with healthcare: people who do not say the truth, and commodification of healthcare. Absolutely.
these doctors, I really don't appreciate. I do appreciate this doctor though, because after that, he knew that I was suturing for free, so he started to send the other patients that were coming to his clinic. He says, "Listen, I am charging. If you don't want to pay, Joe Barud is doing it for free. Go to his clinic." I really appreciated him after that. Now,
Doctor,
yes,
if I can ask a question on the previous case.
yes.
No, you said, is it okay to charge? Would it be also ethical to charge maybe a lesser amount? Or no, يعني the question maybe, is it okay to charge ولا no, باخد على البيشنت ولا ما باخد altogether ولا بيفوت قد ايه الاماونت؟
هلا انه it would be up to you, like if you want to do your social work for free and then charge the patient for the fees of the sutures, so you will not be paying money from your own pocket, this is very acceptable, and the fees would be very minimal. You would be taking $10, 50 thou maybe for the patient, from the patient to do all this, do the work you need to do for him, and you can buy the material. But the question is coming from us. Yani, you guys have lived the disaster. You have lived it. You have lived the economic crisis before it. You have lived the revolution before it. What about the emotional part of the story? Like, would it be ethical living in this country and having lived all this hardship? I don't know. It is a question. Like maybe some people would say, yes, I don't care. I am thriving. I need to survive also. Don't know. No answer. So, okay, this is maybe gonna be the last case, but I will show you more opportunistic people. Now, the opportunistic people are not the doctors, they are the patients right now. And I've got a few. I used this one as an example. So this one, she calls me a very fishy phone call, like a very strong introduction, 5 to 10 minutes introducing herself and what she did. She passed away during the explosion and how they walked and kaza kaza. So I'm like, ma'am, how can I help you? I'm really in a hurry now, and please send me your pictures, and I will help you pass by my clinic any day. I will send you the location. So she sent me these pictures, and it really doesn't take a lot of expertise, because if you have seen 1 or 2 cases of these, or even if you have just a logical mind, doesn't have to be a specialist, you can tell that this is really not a fresh wound. This is not a wound that you're gonna see after 5 to 7 days from the explosion that has healed like this with scar tissue and dimpling. And also you can see permanent lip fillers that were excised here. You can see the scar of the fillers. So I'm like, yeah, okay, this woman, she's probably BSing me, but fine, I will try to help her. So she comes with another friend to witness that she had glass cut her face, and they're both telling me this silly story about how she cut her face with glass during the explosion and how they had to walk bleeding, and they were really عم بيصدقوا كذبتهم يعني. So okay, I went on, played with them the game, and I knew that this case is a case of infected facial fillers. These are permanent fillers, probably silicone fillers that used to be put 10 to 15 years ago. They got infected at one point in time, and she has come with this scarring, and she probably wants care to help. So I asked her, hey, can you show me the initial wound, the initial injury that you have? And she said, yeah, I will try to find. And then she just slipped away. And then I would ask her again and again. And she's like, yeah, I will try to find. So she sends me this blurry picture of this bulla, which is proves my point that this is clearly an, you can see this infection. It's clearly not a sharp cut to the face that got complicated and caused this dimple. Now, anyways, I knew she was not telling the truth. I knew she was taking me for, like, I don't want to say it, but she was taking me for a injury that she had. So, but anyways, I go ahead and I give her the treatment that she needs. I give her silicone patch. I tell her you have to start it intraorally in order to expand, and I all the instructions on what to do. I even tell her, if you will ever need anything else, I will be on board, don't worry. And I silicone patch, it is very expensive. I have limited amount. I am getting them from France, and there are no much left in Lebanon. So you better not lose this silicone patch that I gave you. It should hold with you for a month. So this is ethical question number 9. You know she is lying. You give her the necessary treatment, despite that they are expensive and limited. She keeps calling again and again, asking so many questions, taking too much of your time. Would you continue answering her? Then she loses the patch. It's like, yeah, I threw it by mistake because it was not sticking anymore. I want another one. I can't find another one in the pharmacy. Can you give me another silicone patch? What would you do? Would you give her another patch? What would you say to her? What would the reaction be?
Personally, I wouldn't give her another patch. In addition to her being a liar at the beginning, you have other patients who may need more and who actually deserve it.
Yeah.
So no, I wouldn't.
How would you respond?
Yeah.
How would you respond? Listen, no, I don't have any more, or you would be, listen, you are a big fat liar, just stop calling me.
You don't have to like
Tell her you're a big
address
fat
the.
liar. But,
I would
you told her the
nothing.
first time the patch is expensive and you can't afford to give them out الآن. So you can tell her I have a limited number and مثلا all the patch are, the other patients need them more.
Yeah.
Yeah,
This was
and another possibility could be either maybe telling her that you are gonna have to charge her for it because you can't afford to get as many if and you told her that's gonna last a month and it's her responsibility and if after a week she lost it, then you might want to tell her either to refer her to another doctor who would like follow up with her, or tell her no, you will have to either maybe charge her for the treatment لأنه her case is not as urgent as other you have to take into consideration she's taking time from other people who might need more help, or
maybe I
from the
forgot
focus,
to answer this. Tab, what would you say to her after she came? Like, what would you tell her? Would you tell her, okay, would you do the same thing that I did? Would you tell her, okay, it's fine, I will give you the treatment, but you didn't mention to her that you know that she is not telling the truth?
دكتور هلا I think إنه نحن قاعدين هون ومرتاحين as medical students not being on the spot. What I'm thinking of إنه when she came to the clinic and using my clinical judgment and experience, I would tell her يعني إنه my judgment is that this is not from the blast, and I'm doing this for blast victims. However, I'm gonna help you be as much as you can help without taking the resources from other patients who are in need.
Yeah, like addressing the fact that you know what's going on without disrespecting her. Not calling her a liar, but you're telling her, based on my expertise, I know that this is the case. You might not want to confess, but okay, here's the plan, what we're gonna do. But make sure that to tell her and to show her that you know what's going on and you're not a fool. عرفت؟ but at the same time, respect her, not to disrespect her.
Yeah, I think this was my mistake. Just like, okay, I'm fine, I will gonna help you, but I really knew that I didn't want to face like any didn't want to be confronted because I felt from her character, although I completely agree with what Samira and Muhammad had said before, and I wish I had done what you guys have said, but at the moment this woman with a very strong character, like يعني almost بدها تكل راسي. I just didn't want to confront her.
Yeah.
So Dr. Baroud,
I know, being at the heat of the moment, it's different from being relaxed مثل ما نحن قاعدين and judging the situation.
Dr. Baroud, if I may, we go back to the fraud issue that we talked about, the other physician. One of my main concerns in this issue is the fact that this woman can very easily say to her friends, sorry حكون كتير دجة معك مثل ما اللبنانية بيحكوا، شو أهبل مرقت عليه. So دكتور مرقت عليه وبس ليكو أنا شو طلعت ذكية. We don't want this, okay? But I do, and this is your reputation. But I do agree with Muhammad and Salwa about their arguments, and I'm going to give you yet another one. You would be Samira, sorry. You would be facing two options. So one, either to listen to her and then tell her, I'm a physician and I respect your pain, but I also want you to know that this is not from the هيدا. So أنا دكتورة بشرح لها بهين وأنا عارفين شو عم ساوي. Or you can do something even better if you decided to treat her anyway, which is what you did, to do the procedure. And towards the end of the procedure, there, I hope this solves the problem. But between parentheses, I'd like you to know that I know this is not from the blast. I was not born yesterday. This is the story, and I wish you all the best of luck. And I'll definitely not give her another part of another silicone pouch. I'll leave it to someone else.
Yes.
But
I wanted to ask,
Yes.
additionally, no, when you told her to come in, was it at the same time you were seeing the patients of the blast? Yani, I know you said now you're dedicating your time in a feed from like 5 till 6, you're seeing patients for
Yeah.
this purpose only, but before, was it all the day?
Where it was the peak.
Okay. ما بعرف, I don't know, but I personally feel if I saw هيك case, I might like tell her give her an appointment to like later يعني if you can postpone it later يعني if it's not gonna become more complicated if you give it a couple more days حتى لي ما تكون عم تاخد من الوقت of people who actually were affected by the blast, since you obviously know إنه it's not the result of the blast. That way you might be, you're controlling at least what part of your time she's taking, or يعني حتى not to prioritize her case over the cases that might need more attention.
Yeah. Now,
and that's a triage team will help you definitely.
Inshallah, yes, of course. Now, what she did is she calls and then she says, I really benefited from your silicone patch, and I really cannot find it in any other pharmacy. Please, can you give me another silicone patch? Please, nothing has ever improved this scar so much better than the silicone patch. So to like fall into her own trap, by saying words that she didn't recognize that I would catch. So the way I told her, listen, I really gave you a very big patch. I have a limited supply. There are a lot of injured people. I gave you your own patch. You lost it. Try to find another one. I told you it's very expensive. If any other patches come from France because they are coming from France, I will let you know. And if not, I'm sorry, I cannot give you any more. But she stopped calling, and that was the last time I heard from her. So ما كان لها عين بقى.
I don't
Yeah.
think you should explain yourself to her. خلاص no, can you give me another one? No. You would explain yourself and the situation when you need to, or when you believe you have to give the
I think
explanation.
Dr. Dawood explained himself in a way to tell her indirectly, you've had your share, and this is meant for people who are victims. So it was his indirect way of, if you want, giving her a piece of his mind.
Maybe yes.
Exactly, like because I was very firm to her, and maybe I was like unconsciously trying to explain to her, listen, I know what your scheme is, so just maybe I didn't make her point. I always should be clearer. I am always like reluctant to be firm with people that are not very honest.
Yeah, doctor, I personally have a problem with saying no. I feel it's very difficult. But I keep hearing I should practice more saying no when I should say no.
Okay. For you, for
So,
this sentence, I have for you this last scenario, very quick one, and just because about saying no, learning to say no anymore. Because I have met a lot of patients, and now I don't know when to say no. Where is the disaster? Where is the humanistic? Where is saying yes? Where is saying no? Look at this guy. And this guy really messed up. His face is completely destroyed by glass, scars all over. This is one side, the other side also the same. He's presenting with all these facial scars. He is a fashion designer, so he has butt implants, like in his buttock implants. Instead of breast implants, he has buttock implants to make his buttock look bigger. Okay? And he says that there is a piece of glass that went through his buttock and went to the implant. So this is technically the injury. Okay? So he's like, really, I need your help. I want to change my buttock implants now, and one of them got ruptured. I have someone. They will pay the cost. They will pay the cost of the hospital. They will pay the cost of the buttock implants. But please, I want you to change my buttock implant. So buttock implant, is it replacing a buttock implant considered the humanitarian act? Should I be operating on this case, given that he's going to time of my energy, probably take a time from the space of other people or from my own personal time? Now, this is like, when should you stop? When should you say more? No, no more. Like other came very funny, very funny. Like I just laughed, couldn't but laughed. And she's like, hey, listen, after the explosion, I lost so much weight and now I have all this extra skin here. Can you remove it for me? Just looked at her and smiled and just didn't answer her. So now I'm at this phase. I am at this phase now. Nobody has any more injuries that are acute, no more injuries that are life threatening, or I have done what I can do. And I am starting to be faced with opportunistic people. No, when to say no.
Doctor, I have a technical question. إنه the ruptured buttock, is it serious? يعني, is it dangerous to the patient if it stays?
It is dangerous.
هلا does it بتشوه يعني if it's ruptured بتعمل تشوه؟
It affects the shape of the implant, but didn't affect it drastically.
يعني what I'm trying to reach يعني is إذا هي مأذية للبيشنت وهي فعليا من البلاست, you can just remove both. ما بعرف if putting another one would take extra time which is not necessary. بس if it's serious مثل ما كنا عم نحكي like the other situations, assessing the risks and who's gonna take the time. If it's serious, you just remove it maybe وخلاص.
That's a nice one. I never thought about it really. That's a nice idea. To suggest, I can remove it for like a humanitarian act. I can remove it, help you remove it, to replace it.
Yeah, in which case you'd refer them to someone, or you'd say, you're not dedicating your time right now for this purpose.
The patient has the money. He's claiming that he has the money and he can go to any other doctor.
Yeah, or I can charge for doing this as a regular surgery.
Yes, sure.
Regular surgery.
You can do that. And to answer your question about opportunistic people, let me just remind you that the evil person harms the good person only if the good person lets him. So you can stop them from being opportunistic by knowing when to say no, and how to say it. And definitely, a team would help you triage them from the beginning from your busy schedule. But yeah, that's it.
And I think at that point, when you realize, the injuries or the problems that are, people are coming with are no longer acute injuries that are a result of the blast, I think you can just address your main, the main the starting point where you started. And you started this act to treat people who had major / now minor cuts from the blast. And you can address that. This is why I started. If you guys want me to treat you for other like reasons, I will have to charge you like I regularly charge my patients. And just to make it clear, and that act, okay, I treated the people who I could have treated, but like you guys don't fall into that category, so I can't really treat you equally now. يعني إنه it's not fair. If you think about it, it's really not fair for everyone. يعني إنه people are gonna take the opportunity to like make use of this kind act لحتى to benefit for themselves. إنه طب ما في كتير ناس فيهم يعملوا هيك، إنه ليش you will accept for this person and not for other people.
Yeah, right.
Doctor, I think I have an extra point on no. I think it would be wise if you you don't treat those patients with the part where you take where you charge them. يعني it's better for your reputation and the case overall. إنه بيقولوا عم بيشغلنا شغلة بلاش وشغلة بمصاري It wouldn't be good, although you know what you're doing, but as a wise act, just doing the humane part that you already is doing, will other part just refuse it, even if you can charge them and take the money. And you would be actually doing the right thing, but not the wise thing, I think, if you did that. You got my point?
If I did
I was a bit too wordy. إنه you do the blast as if I can يعني reformulate. بتشيل الimplant, which is what you are doing for the blast victims. هذا part is the humane part. The other part, no, charging them for another implant, you can do that, صح? It would be morally correct, and يعني you'd be on good grounds on this part. But I think it wouldn't be wise to split the same patient into يعني نصه عم ينشغل فيه humane، نصه عم ينشغل فيه as a regular doctor.
Yeah,
I think it would be wise doing just the humane part and
this is
leaving them.
Bravo. This is ethical direction. Patients have injuries to their hands and face. They would ask me to do their face, and then when it comes to their hand, what should I say? Listen, no, only face, only face. Hand, I will not touch it. Like I couldn't do it. I couldn't do it.
Yeah, no. Oh, if it helps the case.
I think it depends. يعني مثلا this person was offering to pay, in which case no, you would agree to pay if you
can agree.
to pay.
I don't think it's wise. It's wise to have the same patient. نص بنص.
If the person's willing to pay, I don't think there's a problem صراحة. إنه if you look at it, you are taking extra time for that patient. If they are willing to pay, then why not? عرفت إنه it would يعني it would save resources for other people maybe.
What was I told them I am going because since you have funding for this implant to get another implant, I am going to charge you half of the charges I charge for my surgery, because I think that this surgery is not purely humanitarian and it's partly cosmetic. So I will be compassionate with you. I will charge you only 50% of what I usually charge.
Yeah,
that's actually a good decision.
Or even just حتى لو مثلا كان the cost of the equipment or the material you're gonna use, and it's at some point مثلا you might tell him I'm just gonna charge you for the material used مثلا.
Yeah.
If you want to be too humanitarian يعني.
Yeah. ما بعرف. I feel that when we're talking about what's wise or less wise, it's خلاص beyond the moral part, which I think the doctor did a great job يعني بهذا البارت. بس ما بعرف. What do you think, Dr. Talia Arawi? Do you hear me?
Excuse me, what is it?
إنه I feel إنه أول شيء the doctor did the right thing, the moral part, إنه that patient with a buttock problem, he removed the
glass.
He did what needs, yeah. The next step was doing an elective surgery, if I may say, which was not considered يعني related to the blast. Do you think it's better to خلاص treat the patient as a victim يعني بس بيشيل البارت اللي هو destroyed ويتركه for another doctor? I think it would be wiser if he did that than splitting the same patient between victim blast and the second part being a regular patient.
It's a very good point. Yes, and this background noise. I would say this case, just like the case of the woman who had the silicone implant, I would, for this patient, yes, remove the piece of glass and tell him that there is no danger anymore. But I recommend for you to take an appointment with a plastic surgeon to fix it, because it's not emergency. It's not part of our humanitarian fund donations. Yeah. Or you can take an appointment with me. It's up to you. Feel free what to do. Because on another note, Dr. Baroud, you have a moral responsibility towards the donations that were given to you. So you can't use them except for humanitarian purposes, for you to feel at ease with your conscience, which I know is superb anyway. So, yes.
Of course. Thank you, guys. Thank you very much for this is my story.
Thank you, Doctor, يعني for sharing this with us.
Your comments عن جد كتير بعقله. Thank you, Sarah. Thank you, Dr. Arabi, Muhammad.
God bless you. And we will get back to you regarding a team who is, inshallah, willing to help you. I already have one volunteer on WhatsApp. So, Allah awake, very proud, and you humble me, really. Aslamta. Kissing you back. Yalla.
Ciao.
Thank you, everyone, for joining. Bye.
Thank you.